Hi everyone, I'm Renee, and today I want to try and explain the difference between Cushing's disease and Cushing's syndrome and just kind of explain a little bit how the endocrine system works. I'm not a medical professional, so I will probably butcher half the words I'm going to try and say to you, but you will get the point anyways. So first I want to explain the endocrine system. It's a very, very delicate system which includes your pituitary gland located at the base of your brain, your thyroid, your adrenal glands, which are glands located right above your kidneys. I believe the pancreas may also be a part of the endocrine system, but I'm not sure about that. I really only know specifics of Cushing's. So first off, there's a part of your brain called the hypothalamus, I think. I'm probably getting that wrong. Anyways, the hypothalamus is located at the base of your brain, and from that hangs your pituitary gland. So there's a very delicate system here that I'm going to try and explain, and Cushing's affects this system. So your hypothalamus sends a hormone called the corticotropin-releasing hormone to your pituitary gland, and it signals that pituitary gland to make ACTH, which is adrenocorticotropin hormone. ACTH signals your adrenal glands to produce cortisol, or to release cortisol into the bloodstream. So it's a very delicate system. You know, your hypothalamus has to work, your pituitary has to work, all the signals need to be connected and working together. Functioning properly, otherwise you have problems like Cushing's disease or Addison's disease, which I'll try to explain a little bit later. So first off, cortisol is what affects you in Cushing's disease. It's a very important hormone. It's essentially your stress hormone. It helps the body respond to stress. It helps maintain your blood pressure. It helps reduces the system's inflammatory response. It balances the effects of insulin, and it also helps your metabolism. So you'll see a lot of people with Cushing's have extremely high blood pressure. Mine was through the roof. You have trouble controlling your blood sugars. I had something called diabetes insipidus while I was sick, and then very bad right after surgery. It just helps you maintain your blood sugar and things like that. And so because my very delicate endocrine system wasn't working right, diabetes insipidus, I was drinking a lot and, of course, using the bathroom a lot. And it regulates your metabolism, too. So something that a lot of Cushies complain about is something called high cortisol hunger. It's just this extremely strange hunger. I mean, it's gnawing at you. And the only way to make it go away is eat, most of the time. So now I just want to try and go through the specifics of Cushing's disease and Cushing's syndrome. Cushing's disease is specific to one cause of Cushing's, and that is a pituitary tumor that produces too much ACTH. That's what I had. I had Cushing's disease. I had the pituitary tumor removed 2 years ago. When you have a tumor located on a specific place in your pituitary, it causes it to produce ACTH without being signaled by the hypothalamus. The tumor itself is an ACTH producing tumor. Now I said on a specific place on your pituitary because tumors on other places of your pituitary can cause different problems. One is a prolactinoma, which can cause other problems. I'm not really sure exactly what that is. I've only done a little bit of reading up on it. But a prolactinoma causes too much prolactin, which is just another hormone. So you can see how sensitive the pituitary is. And so if the pituitary is constantly signaling the adrenals to release cortisol into the bloodstream, and then, of course, too much cortisol causes Cushing's. Now, Cushing's syndrome can be caused by other problems. Adrenal tumors themselves can release too much cortisol into the bloodstream. These tumors are most often non-cancerous, and they're actually 5 times more common in women than in men. So is Cushing's disease. It's 5 times more common in women than in men. Not saying that men don't get it, but It just seems to be more common in women. So again, if you have adrenal tumors, it is just specifically causing the adrenals to produce too much cortisol into the bloodstream. And there is also ectopic ACTH syndrome, which is Cushing's syndrome caused by tumors that are outside the pituitary that can produce ACTH. Lung tumors occur in more than half of the cases of ectopic ACTH and affect 3 times more men than women. So I don't really know why that's like that. That's just something we need more research on, I guess. These tumors can be small cell lung cancer, slow-growing tumors, or carcinoid tumors that come from hormone-producing cells in various parts of the body. Tumors of the pancreas or the thyroid, so I guess, yes, the pancreas is part of it, can also cause Cushing's syndrome. So that is just another cause of Cushing's syndrome. There is also Cushingoid, which is Cushing's, that refers to Cushing's syndrome caused by medications or steroids that are used to treat problems such as asthma and things like that. Prednisone, hydrocortisone, dexamethasone are some of the meds that can cause Cushingoid. Cushingoid does not have the same long-term effects as Cushing's, either the other types of Cushing's I just talked about, and does not require treatment of the endocrine glands. So most of the time, if you have Cushingoid, your doctor will either try to slowly wean you off your asthma medication or whatever it is you're taking steroids for and maybe switch it around. It's just very important that you do wean slowly off of it. Stopping it immediately can cause some serious effects on you. So that is another time. There is one more type, and that's called pseudo-Cushing's, caused by, a lot of things can cause pseudo-Cushing's, and it is taken care of by basically just kind of changing your lifestyle. Pseudo-Cushing's can be caused by depression, anxiety disorders, alcoholism, and poorly controlled diabetes. So you can get pseudo-Cushing's, and normally you just try to change your lifestyle to fix that, but you will get some of the symptoms of Cushing's, which are moon phase, weight gain, high blood pressure, high blood sugars, acne, balding, just a bunch of different things. And now, most doctors will tell you that Cushing's is not hereditary, but there needs to be a lot more research before anybody can say this. I'm pretty sure I've actually met some people that have Cushing's where their kids have had Cushing's. I'm not really sure on what type of Cushing's they had, but I just know that I met a family that's dealing with it. So most doctors will tell you that it's not hereditary, but there is something called familial Cushing's, like I said, and rarely results from an inherited tendency to produce tumors on your endocrine system. So, if your mom grew some tumors, you might be likely to grow tumors too. So that's one thing that I constantly worry about, is whether or not my kids are gonna get it, because I had it. So it's something, at least I guess I know what to look for now, and I can watch them closely and be able to get them treatment if anything ever does come up, which, fingers crossed, it does not happen. I wouldn't wish this disease on anybody in the world, and I would really, really hate to see my kids go through it. So that's Cushing's in a nutshell. I hope that my explanation was good enough to actually be understandable. So there's very many different things that can cause Cushing's syndrome. Only the pituitary tumor causes Cushing's disease. Like I said, some of the symptoms are, weight gain, moon phase, blood pressure, blah, blah, blah. I already said all that. So it's very important. Your endocrine system is so delicate, and just a tiny, tiny imbalance in it will affect you immensely. I think that's all I'm going to talk about today. I'm getting about to the 10-minute mark, so I just want to try to keep them bearable, keep my videos bearable for you guys. I think next time I want to talk a little bit about the symptoms I was having, because there's the textbook symptoms that if you go and you research Cushing's, they'll tell you, you know, moon face, they'll tell you the weight gain, they'll tell you stretch marks, acne, you know, missed menstrual cycles, decreased sexual libido in both men and women. So they'll tell you the classic textbook cases, things if you look it up online, but there are so many things that aren't listed, you know, that I could talk about forever. But I'll get into that in another video. So again, I hope you guys have a wonderful day, and I'll see you again next time.